Yeah, so I'm Luke Forster. I'm a consultant urologist. My practice is in Buckinghamshire and Berkshire. My NHS practice is at Frimley Health Foundation Trust, and I'm the clinical lead at Wexham Park Hospital. I treat most urological conditions, but my main subspecialty is kidney stone disease. Uh, as well as my clinical work, I'm the Trust Director of Undergraduate Medical Education. I became a doctor and a urologist specifically to help people. And urology is a very sort of fast-moving and varied specialty. We'll have some patients where you see them and treat them within minutes or hours, and then you have other patients where you build that working relationship with them and look after them for years, managing different challenges. And sometimes that can be a condition related to cancer, or sometimes a non-cancerous condition really affecting people's quality of life. So I think that variety, the challenges, no days the same, and ultimately being able to help patients, whether it's an emergency situation or with a sort of long-term issue over many years of their life. The sort of interactions and the relationships you build with patients. So you'll have some people where they come to you in absolute crisis, where they're having literally the worst day of their life, and they need immediate assessment and intervention to either treat their condition or to get their pain sort of under control or prevent things from getting worse. You have other people where they've got a niggling problem where it's been bothering them for months or years, and there's a risk that might get worse in the future if that's not addressed. So that sort of variety of patient that comes to you, and I guess you have to get to know them. You have to listen to their issues, try and understand it. You know, some people will be affecting their sleep, other people will be affecting their work, and you need to work out what the sort of priorities are for each patient, and try and work out what's going on, give advice to the patient, and then come up with a plan together to make things better. Well, I think it's that I spend time to try and understand the problem from the patient perspective. Um, so I with any patient that comes to me, I'll conduct a detailed assessment and evaluation. We might need to organise different tests to get information about the situation, and then I really try and understand what it is that's the patient's priority. You know, is it something affecting their sort of their work life or their home life, or is it that they can't travel anymore? And it's that really just trying to spend that time, empathize with the patient, and really explain things clearly. Because for those patients, it's often very sort of scary, and people feel vulnerable coming to a doctor. They might be anxious about symptoms. You know, could this be cancer? Could it be something else? And I try and spend time to listen to those concerns, understand what the patient's really worried about, and then present all the information as I see it to the patient, and then usually we can come up with a sort of sensible and safe plan for the patient to help them with their situation.